I would now like to recognize Dr. McCormick for the purpose of making an opening statement.
Thank you, Chairman Westrup and Ranking Member Ruiz, for the special opportunity to address this committee as my concerns as an ER doctor who served during this entire pandemic. It's a special occasion for me. I just rewrote my entire opening statement in the last 5 minutes, just listening to the words. These words sound great. The tools, we gave you guys the tools. There was great collaboration. They allowed us to. We removed barriers. We got more affordable health care. Those are all words we've heard recently by the government. The problem is when the tools are biased by the government, when collaboration means the government gets its way, or bribes scientists, or gives them grants or bonuses to change their opinion. When they say allows us to, that means once the government gives you permission to. When they say removes barriers, unless the government disagrees. When they say affordable health care, I don't know of anybody who in America thinks we have affordable health care. So let's start there. Beginning in March 2020, the government took over the conversation of health care. For the first time ever, at least in my lifetime, we had a novel virus that was killing people. And for the first time ever, the collaboration between doctors and patients was interfered with, and also doctors, and also doctors and scientists, because the government got to have the ultimate say-so. There's the biggest problem. In 2020, as a person who was involved in treating patients before we even knew what it was called, before we even knew what was going on, when we see fevers, as exposed repeatedly, I was censored when I had a scientific/medical opinion that turned out to be right, by the way, but that's inconsequential. The fact is, the government got to tell me what was right and wrong. Government officials who hadn't seen a patient in decades or at all. People who didn't have an MD, who'd never seen a person in the ER, who'd never treated a virus in their life, got to censor me, and some people even threatened to take away my license because I disagree with them. Because I'm an expert too, I found this the biggest problem in the whole approach. It's not collaboration when the government gets to say so, and when they are the expert. And this goes back to our basic political philosophy. Is government the equivalent of God? Are they the moral authority? Are they the equivalent of physicians and medical authority? Are they the equivalent of business owners and get to tell you when your business is open and closed, who you hire and fire, whether you should get vaccinated, whether you can travel? This is the fundamental difference that we are arguing today. As a healthcare provider and as an American citizen who has rights that are inalienable, not given to me by the government, but given to me by God, in my opinion. The American people deserve to make medical decisions through the caring and informed conversations with their physician rather than through politically motivated mandates. The American people deserve a choice. The freedom of choice is as fundamental to this country as anything that ever existed. The COVID pandemic wreaked havoc on it. We all agree on that. We know it was a horrible thing, but we can't even agree on the science of what started this pandemic without making it political. Now, just to be clear, I'm not against someone wearing a mask. I'm not against someone getting a vaccination. I was actually one of the first people in the United States to get a vaccination as an ER doc on the front lines, seeing thousands of COVID patients. The science seemed clear to me at the time that would have a real benefit against a novel virus from becoming ill and not being able to serve my patients. I got the vaccine willingly, and I'm a military guy. Over 21 years in the military, I've gotten plenty of vaccinations in my time. It doesn't scare me. But as soon as the government said, you will, you're going to have resistance. And ironically, it's not just the white conservatives, it's the black liberals, because people don't trust the government. And as soon as you say, I really want you to get this, and they say, no, thank you, and you say, no, I want you to get this, no, thank you, no, you're going to get this, you know what the response is going to be from those people. You galvanize people. You don't attract them to something. And that's the political nature that we made this disease, and it actually defeated the purpose of a good conversation between a physician and the patient, and what would be maybe a real benefit to a vaccination. Now, that has modified. Over time, the science has changed, so to speak. Well, the science hasn't changed, but the opinion has. Whether we use NSAIDs or steroids or different medications has changed. Now, the science changed and we're able to do that, but ultimately, we have to let the scientists and the medical professionals and the patients have those conversations if we're going to keep this from being a political conversation rather than a medical conversation. And that's what I'm sticking up for. Thank you very much, and with that, I yield.